Creating system leadership in health and wellbeing boards, and one of the unique issues that binds us is the fact that we have a shared purpose, we serve the same population, we're funded by that population, and we need to get the needs of that population and their views involved.
The first thing I'd say is actually have a really good conversation about what system leadership means to you. We all talk about it as if we think it's the same thing, and actually having a really good conversation about what you think it means, what the important elements of that would be, I think, my first kind of recommendation. And I think the other thing would be to invest in what's your shared purpose. So I know you'll have lots of strategies and lots of written documents, but actually have you sat down and can you articulate it to other people so that they can join you, they can support you and help you. And I think that's probably the most difficult piece of work for boards to do, really.
My top recommendation to other health and wellbeing boards is that be radical, be innovative. You've got can-do people around the table in terms of counsellors and GPs. These are professionals that want to get things done. I think health and wellbeing boards have the opportunity to really push the boat out and try new innovative stuff where new solutions to old problems.
For the health and wellbeing board to behave in a systemic way, they need to be visible leadership, accountable body, and clarity in terms of their vision and objectives and outcomes. And indeed, that's something which we've been trying to develop. And it is about how do we create the trust between the community and the health and well-being, and to make sure that the health and well-being become the conduit to deliver the services required and indeed listen to the community out there.
The work that we've been doing has given us lots of insight to the key qualities and behaviours that leaders need to demonstrate to make a real difference when they're leading across communities, leading across places, leading across systems. It's the mindset people bring. You can have the best processes in the world, the best technical solutions in the world. If people don't want to engage with this, it's all going to fall to pieces. So we often talk about the fact it's better to have can't-do systems with can-do people than it is to have perfect systems with people who don't want to engage.
Each speaker has stressed community engagement, and I've been quite surprised at that because it's something as counsellors that we battle hard to get people to understand. At the end of the day, we are elected by the people and we feel very much we're there as advocates, not there necessarily in our strategic responsibility roles. And I'm really pleased that that has come across, whether it be from DPHs or whether it comes back from CCG, chief execs, or even if it's come back from NHS England. It's really, really gratifying to know that that is at the understanding and the level of debate that we've had today.
To be system leaders, health and wellbeing boards have to have very visible joint leadership, and that's right from the top. So we need to have the Mayor, who's the chair of the Health and Wellbeing Board, and the chair of the CCG standing right beside each other and talking to partners, telling them about the direction that we need to go in. And I think as well to have a clear focus on one big thing, so whether that's minimum unit pricing for alcohol, whether it's delivering on the ambitions in the Mayor's health strategy, it's about being clear that we're both focusing on the same things and working together.
It's about engagement, but I also think rather than sharing their vision for the place, actually listening to the people's vision, I guess would be one of the things that I'm sure lots of people are already doing, but having more listening rather than consultation events, actually going out and asking people, what is your vision for this place? How can we build that into our shared strategy? I think would be a fantastic thing to do. And I'm sure there's lots of great practice out there already doing it, and maybe we just need to share some of those engagement and listening approaches, really.
The key learning point for today is actually looking at the opportunity of fragmentation. People criticise the new changes in the health and social system as fragmenting the different parts, but in fact that allows us to rebuild it in an appropriate way with everyone investing their time to make it work properly.